How are false positive bone cancer recurrence results interpreted? Imagine going for a scan and hearing that your cancer might be back, only to find out later it was a false alarm. False positive results in monitoring bone cancer recurrence happen when imaging tests suggest the cancer has returned or worsened, but further checks show no actual cancer. These false alarms can be confusing and stressful, but understanding how they are interpreted can help ease concerns. False positives often happen because certain benign bone changes look similar to cancer on scans. For example, bone marrow reconversion is a process where the marrow changes its composition, often due to treatment or stress. On MRI scans, this can look like cancerous lesions, but it is actually a normal or benign change. Inflammatory or infectious processes in the bone or nearby tissues can also cause increased activity on PET scans or bone scans, mimicking metastases. Conditions like modic type 1 vertebral changes involve inflammation and increased bone activity near the vertebral endplates, which can also produce signals that look like cancer spread. Another common cause of false positives is the flare phenomenon seen on bone scans. When bones heal or react to treatment, they may temporarily take up more of the radiotracer used in scans. This increased activity can be mistaken for cancer growth, especially shortly after starting therapy. To avoid misinterpretation, doctors look at the timing of scans, clinical symptoms, and other factors. Interpreting these results involves a team of specialists. Radiologists and oncologists carefully analyze images from different scans like MRI, CORT, PET, and bone scans. They compare patterns across these images to distinguish benign changes from true cancer recurrence. Doctors also consider the patient's symptoms, lab tests, and the timing of scans relative to treatment. Sometimes, follow-up scans over time are needed to see if suspicious areas stay the same, improve, or worsen. If uncertainty remains, a biopsy or additional tests may be performed to confirm whether the lesion is cancer or not. It's important to remember that false positives are common and part of the careful process of monitoring. Recognizing these pitfalls helps prevent unnecessary treatments, reduces patient anxiety, and avoids invasive procedures. Doctors always communicate with patients about the possibility of false alarms, emphasizing that further testing is often needed before making decisions. In long-term survivorship, understanding that not every suspicious finding means cancer has returned helps patients stay calm and focused on their ongoing health. Ultimately, interpreting false positive results requires combining imaging findings with clinical information and expert judgment. This balanced approach ensures patients receive appropriate care, avoiding overtreatment while catching true recurrences early. Always consult healthcare professionals for personalized advice and follow their guidance for ongoing monitoring.